Yeah, that's right, Jen. And as you just mentioned, this booster dose would only be authorized for a very narrow subset of the population, with no word yet on when it might be authorized to the general population.
It will be important for them to get that booster.
The FDA has authorized a third or booster dose of the mRNA COVID vaccines. That's Pfizer and Moderna. Can you mix the shots?
The people I talk to and who I count on believe, for the most part, that mixing and matching will be okay.
But the FDA didn't give any guidance to the 10 million Americans who got the one-shot Johnson & Johnson vaccine. Not mRNA. It's based on what's called a viral vector platform.
The J&J will need further, will need further evaluation.
With Connecticut's mass vaccine clinic shut down, getting access to a booster dose would likely come from your primary care doctor, a pharmacy, or a pop-up clinic. But the community health center hasn't ruled out reopening some of the larger vaccine sites.
The most I can say now is that we are planning how dose 3, what our access is, what the eligibility criteria is.
The booster doses were only authorized for those who are immunocompromised. That's about 3% of the population, but 44% of the people who get hospitalized for COVID. It's important that the FDA clearly defined immunocompromised.
We don't want somebody saying to us, immunocompromised, use your own definition of it, because quite frankly, an 85-year-old person is immunocompromised compared with a 45-year-old person.
In the category of eligible booster recipients, organ transplant patients and cancer patients.
They are on medications purposely decreasing their immune response.
Marnie White of Fairfield is one of the 9 million Americans who are immunocompromised.
About a month before the pandemic, I was diagnosed with a serious and often fatal autoimmune disease that requires a type of chemotherapy.
She worries about her 10-year-old son going back to school in the fall and bringing the virus home.
He is 10 and therefore a perfect little carrier for this.